Well, good day everyone, and welcome to our Indigenous Self-Identification training. My name is Len Pierre. I am Co-Salish from Katzie First Nation, and I am the lead for Indigenous Cultural Safety Initiatives at Fraser Health Authority. This course really is designed to address two things in the Indigenous self-identification process in the healthcare setting. The first is why? Why do we ask this question in healthcare? And number two, what happens to that information once it is collected from the Indigenous communities that we aim to serve? So to address the number one, why do we ask this question? I think that we have a lot of friends and colleagues in healthcare who feel like this question is discriminatory or exclusive in nature from clients and folks who mean to, access our services. And if I might just say, to be transparent, that as an Indigenous person, we are asked this Indigenous self-identification question in many different areas of Canadian systems today. So we're asked this question in education, in the social services sector, in the judicial system, and in that regard. So why we ask the question is, capturing the demographic data of whether or not somebody is or is not Indigenous really does inform our current healthcare practices, our programs, and our services. And then of course, in a very historical context, we do have a gap in health and wellness outcomes that we experience as Indigenous peoples in this country. By collecting whether or not somebody chooses to identify as Indigenous or not really helps us assess and evaluate our programs and services at the institutional level so that we may aim to narrow that gap. So it ultimately improves our cultural safety initiative in Fraser Health. I would also add that capturing that data, whether or not somebody self-identifies as Indigenous, at the end of the day, we can offer Indigenous people who self-identify with other resources and other services embedded in our healthcare system. Services like cultural advisors, elders, or traditional healing practices, or Aboriginal health liaisons to kind of help also create an element of cultural safety and wraparound support in our healthcare system. Number two, what do we do with this data once it is collected? Again, at a very institutional level, it helps inform our programs and services, how effective our programs and services are at the cultural safety initiative level. But it also really helps us uphold our commitments to our community partners. Partners like the Métis Nation of British Columbia, the First Nations Health Authority, each and every one of the 32 First Nations communities that we've signed a partnership accord with. Again, we are opening the accessibility to how effective our healthcare system is. So it's a very crucial and critical step answered in two questions that you'll see later on in this course. So thank you very much for taking the time and the willingness to be here to learn about why it is that we do the Indigenous self-identification process in the healthcare setting.